Good day, everyone. Today, I'm going to talk about the primary prevention of cervical cancer. Before we zero into the primary prevention of cervical cancer, let me define the different preventive measures. Primary prevention is a measure to prevent exposure to a disease or etiologic agent causing the cancer or infection. Because of these interventions, a disease or infection or condition will not occur. Examples include vaccination to prevent a communicable disease, wearing helmet to prevent head injury, and avoiding smoking. Secondary prevention are preventive measures to reduce the impact of the disease by early detection. In this situation, the causative agent has been acquired, and this measure only slows down the progression to the disease to reduce its impact. Most screening modalities like mammography and pap smear are under this category. Daily exercise may be under primary and secondary prevention. Tertiary prevention measures are preventive measures to reduce the complication of the disease, examples of which are cardiac and physical rehabilitation. For us to know the different preventive measures for cervical cancer, it is imperative to have knowledge on its different risk factors. Human papillomavirus is the primary causative agent for cervical cancer. It is primarily transmitted through sexual contact. HPV is usually eliminated by host immune system, and clinical presentation only occurs after a persistent infection wherein the HPV is not eliminated. These are the different organs affected by the human papillomavirus by incidence. It is important to note that 99% of cervical cancers are caused by oncogenic type or cancer-producing human papillomavirus. These are the risk factors for cervical cancer and other HPV-related malignancies. It includes having multiple sexual partners, having multiple pregnancies and deliveries, early age of first coitus and first pregnancy, smoking and oral contraceptive use, having low immunity, particularly in patients with HIV or immunosuppression, and having no or irregular cervical cancer screening tests. Let us discuss each risk factors. Having multiple sex partners increases a woman's risk to have cervical cancer. Since viral transmission of HPV is through sexual contact, having more sex partners increases the chance of getting different cancer-producing HPV types. This also applies to the patient's sex partner. If the patient only has one sex partner, but her partner has multiple sex partners, she is also at risk to acquire the virus. This is the cervix of a woman who have not had vaginal delivery. And this is the cervix of a woman who have had vaginal delivery already. The difference is the location of the transformation zone, which is the most common site where cervical cancer develops. It is located more outside at the ectocervix, being more exposed to HPV. This is why multiporous women are more prone to develop cervical cancer than nulliporous women. In addition, pregnancy with high level of estrogen and progesterone modulates the immune response, preventing elimination of the virus, leading to persistent infection. Early age of first coitus and first pregnancy makes a woman at higher risk to develop cervical cancer. This is due to early exposure to the cancer-producing human papillomavirus. Smoking increases the risk to develop cervical cancer by preventing elimination of the virus by the woman's immune system. Another reason for the development of cervical cancer in smokers is the direct effect of cancer-producing or carcinogenic component of the tobacco. Oral contraceptive pill use also increases the woman's risk to develop cervical cancer. The estrogen component of the OCP promotes integration of the virus into the host cells. This effect is only seen in women who use OCPs for 5 years or longer. Immunity plays a vital role in elimination of human papillomavirus. Patients with immunocompromised conditions like HIV cannot eliminate the human papillomavirus, causing persistent infection leading to pre-malignant lesion and cervical cancer. The aim of cervical cancer screening, either by HPV DNA testing or pap smear, is to detect presence of high-risk HPV or to detect abnormal cervical cells caused by the virus. Having no cervical cancer screening increases a woman's risk to die from cervical cancer from 3 to 10 folds because cervical lesion is not detected at a very early stage. Let's now talk about the primary prevention for cervical cancer, which are measures to prevent exposure to the causative agent human papillomavirus. Primary prevention is as easy as A, B, C. A for abstinence, B for barrier method, V for vaccination, and C for commitment by being monogamous. A for abstinence. Since sexual or genital contact is the primary route of HPV transmission, abstinence from sexual contact is the most effective approach to prevent HPV infection. This will prevent transmission of the virus from one person to another. B for barrier method. Consistent and correct use of barrier protection, particularly the condom, decreases cervical cancer incidence. This is by preventing direct contact of the vagina and cervical tissue to the penis and its skin that may contain the virus during intercourse. This also prevents different types of sexually transmitted infections and unwanted pregnancy. V for vaccination. Vaccination against high-risk HPV or the cancer-producing type of HPV is efficacious to prevent HPV infection that will lead to cervical pre-malignant lesion and cervical cancer. At present, there are 3 types of anti-cervical cancer vaccines. One containing 2 types of HPV called Cervarix, the other one containing 4 types called Gardasil 4, and the last one containing 9 types of HPV called Gardasil 9. Cervarix contains the 2 most common cancer-producing HPV, 16 and 18, and it is given at 0, 1, and 6-month interval. Gardasil 4 contains the 2 most common cancer-producing HPV, 16 and 18, and the 2 most common genital wart-producing HPV, 6 and 11. Gardasil 9 contains the 2 most common wart-producing HPV and the 7 most common cancer-producing HPV types. Both Gardasil 4 and 9 are given at 0, 2, and 6-month interval. And C for commitment by being monogamous. This is done by having one lifetime mutual monogamous relationship. Having only one sexual partner prevents HPV transmission, hence preventing HPV infection. Having healthy lifestyle may also prevent cervical cancer development. This can be done by having proper nutrition, adequate exercise, and avoiding smoking, leading to better immune system. Remember that having good immune system eliminates majority of HPV, thus lowering the chance of having cervical cancer. In summary, primary prevention for cervical cancer is as easy as abstinence, barrier method, vaccination, commitment, and having healthy lifestyle. Good day, everyone.